Good morning, everyone. This is Jennifer Yost from the National Collaborating Center for Methods and Tools. Thank you so much for joining us today for our NCCMT Spotlight on KT Methods and Tools webinar series. We will be getting started in a few moments. Just a few housekeeping things. The first is that we are going to be referencing a systematic review today, and in a few moments you should see a link to that systematic review pop up in the chat box. So if you would like to, please go ahead and click on the link and access the open access version of the systematic review. The second housekeeping item is that we are going to ask you to post all of your comments and questions in the QA, and you'll press send to send the questions to all, not privately to just the host, but so everyone can see. Regarding connection, we recommend that you use a wired internet connection versus wireless, and there is the WebEx 24-hour, 7 days a week helpline listed as well. You'll also see in a few moments that there will be some demographic questions about what province you're in and where you work in public health that will pop up, and we will begin to get the webinar started officially in a few moments. Good morning again. This is Jennifer Yost at the National Collaborating Center for Methods and Tools. We would like to welcome you to our NCCMT Spotlight on KT Methods and Tools series. Just a few housekeeping issues before we get started. One is that today we're going to be referencing a systematic review to help us along with the Anatomy of a Systematic Review fact sheet. You will see the link to that systematic review posted in the chat box. Second is that we are going to be asking you to post all of your comments and questions in the Q&A box, and please send, remember to hit send, questions to all, not just the host privately. And regarding connection issues, we recommend that you use a wired internet connection versus a wireless internet connection. There's also some housekeeping issues about if you're having any issues with your audio and what to do, posted in the chat box as well. So there are some polling questions that are popping up, asking, as we get started this morning, asking participants, those of you who have joined us, where you are from and what sector that you work in. So just as we see what's happening, we can see that most people are from Ontario, but we have some people joining us today from BC and Alberta and Nova Scotia, New Brunswick. And it seems that the majority of people joining today are in public health and research. So that's great. That's really great. So we seem to have a really great mix of people joining us today. So please, if you have not filled out those questions, if you'd like to keep filling those questions out, that would be great. And we're going to go ahead and get started. So again, I would like to officially welcome you to our Spotlight series on KT methods and tools. It's a series that we've been running over the past few years, in which we choose to highlight a specific method or tool from the registry of methods and tools on the National Collaborating Center for Methods and Tools. So today is our 17th episode, and we are featuring the National Collaborating Center for Methods and Tools Anatomy of a Systematic Review fact sheet. So for those of you who may or may not be familiar with the National Collaborating Center for Methods and Tools, it is one of 6 national collaborating centers dispersed throughout the country that is funded by the Public Health Agency of Canada. While 4 of the NCCs support the use of research evidence in specific public health content areas, NCCMT and the NCC Healthy Public Policy work across areas, and our focus at NCCMT is to improve the access to and use of methods and tools to support moving research evidence into practice decisions related to public health, practice, programs, and policy in Canada. So to do that, we offer a variety of products and services. One, which is the Registry of Methods and Tools, from which we're featuring one of the tools today. We have multiple online learning opportunities, including online learning modules to support public health professionals working through evidence-informed decision-making. And we also have some multimedia products and services, such as our Using Research Evidence videos. So it's my pleasure today to welcome our advisor on tap, Dr. Maureen Dobbins, who is a professor in the School of Nursing at McMaster University. She is also the Scientific Director of the National Collaborating Center for Methods and Tools, or NCCMT, and the Scientific Director for Health Evidence, which is a repository for systematic reviews on public health interventions. So it's my pleasure today to turn over the webinar to Dr. Maureen Dobbins. Please feel free to, as we mentioned, post your comments and questions in the Q&A box as we go along. There'll be plenty of time at the end of the conclusion of Dr. Dobbins' presentation for us to talk about those questions and ask them of Dr. Dobbins. So thank you very much.
Great, thanks Jenny, and it's my pleasure to be joining you today to talk about this new tool that's been out for, I think, about 6 weeks or so now from the National Collaborating Center. It's been flying off the shelves. We've been really overwhelmed by how well this new tool on anatomy of systematic review is being received by public health in Canada, and we just want to give you a little bit more detail on this tool and why we developed it and why it may be of use to you. So we're just asking you to comment right now if prior to today you had heard about this tool, Anatomy of a Systematic Review fact sheet, prior to today, and so you're just answering that, and it seems like the majority of you were not familiar. A few of you are, which is great to see, so wonderful that you've joined to learn more about it. So first, if we just start with thinking about what is a systematic review and how is that different from other kinds of reviews that you may be familiar with. And so a systematic review is a rigorous summary of all the primary research evidence that's relevant to the particular question that you're interested in answering. And it's using a very explicit process that others could replicate. And so a systematic review is really you would want to have developed a protocol for how every part of that review will be conducted, that is identified and explicitly documented prior to starting your systematic review, and that all of these details about how the review was conducted is provided and accessible prior to the review being done, as well as within that review document. This was created as a methodology more than 20 years ago. The Cochrane collaboration has been working hard for 2 decades now to really continue to develop the methodology for conducting good quality, bias-free ways to synthesize the evidence. And it's really through these very rigorous processes that we can avoid bias in the results that we get from our systematic reviews. So just in terms of where are syntheses or systematic reviews or meta-analyses located on this 6S pyramid. So some of you who have followed us in the past would be familiar with the 6S pyramid of evidence. And what this pyramid really is all about is suggesting that as we go up the pyramid, the extent to which evidence is synthesized becomes greater. So at the very top of the pyramid, we have our most synthesized levels of evidence. Systems exist where we bring together patient characteristics, diagnoses, other factors related to the patient, and that behind the scenes in an electronic system brings together the best available critically appraised evidence. That could be in the form of best practice guidelines. So the system brings together what we know from the best available evidence and what we know about a particular patient, and then comes forth with specific recommendations for the healthcare system or for the healthcare provider they may want to take into account for that particular patient. We don't have systems for public health at this time in Canada, and so when we look at this pyramid, we're really talking about joining the pyramid or looking first for evidence at that summaries level. Summaries level evidence is really best practice guidelines, which is a combination of the best available research evidence paired with expert opinion and consensus, and bringing that all together. Then we move down to synopses of syntheses, which are short summaries of a systematic review. And then we have our syntheses, of which there are a number of organizations around the world that conduct syntheses. And then we move down from there to synopses of single studies, and then our single studies. And so the tool, Anatomy of a Systematic Review, the fact sheet, is really specifically about syntheses, and we can see here is right in the middle of the pyramid. So I'm just going to ask another question of you now. How often do you use systematic reviews to inform a program or service decision? And you can see there you have 4 choices, from always through to never. So I'm just going to give you a moment to complete that poll. Certainly one of the components that we focus on at the National Collaborating Center for Methods and Tools is how to help public health decision makers develop the knowledge, skill, and capacity that they need in order to use the best available research evidence, which is more than just systematic reviews, but of course systematic reviews would fall into that sphere. So just in terms of the way the data is looking right now in terms of your responses, approximately 10% of you say you always use systematic reviews to inform program or service decisions. Approximately 20% are saying often, 23% saying sometimes, and 7% saying never. And then there are just a few that haven't responded to that question. So thank you for that. So in terms of an anatomy of a systematic review, certainly we really like the really nicely laid out systematic reviews that would follow these types of headings here. We start with really a title, and then after that, an abstract, followed by an introduction that tells us what the review is about, our methods, results, discussions, and conclusion. Not all systematic reviews or publications of systematic reviews really follow this exact approach, but when they do, it's much easier for us to read them and to get the information. Really focus on those parts of the review that will get us the kind of information that we're looking for. The purpose behind creating the Anatomy of a Systematic Review fact sheet was to speed up the process of you assessing, one, what the review is about so you can determine if it's relevant, and then two, has this review been done rigorously enough that it warrants reading further or investing more time in really exploring what the results are. And so what we want to do is, if you are doing a critical appraisal of a systematic review, how can we have you complete that in just seconds or minutes as opposed to it being a much longer exercise? And that's what the tool is attempting to achieve. So as I'm sure many of you would be aware, what would we find in an abstract and introduction? So of course, an abstract is usually somewhere between 250 to 300 words, gives us that very high-level summary. What is this review about? What was the question being answered? How did they find the studies? How did they aggregate them? Then we move on to what were the results, the specific findings, and then an overall conclusion. So we find that in our abstract, and sometimes we can even start answering our critical appraisal questions by what is in the abstract. And then our introduction usually goes into the background literature. What do we already know about this particular topic? Generally might be 3-4 paragraphs long, and really sets the stage for why this review was important to do, what the issues are that we need answers to, and it usually ends by telling us what the specific question is that needs to be answered. The methods is where you really, in that initial assessment of determining whether or not this review is good enough to inform practice, the methods is what you really want to be focusing on to address those critical appraisal questions about how they did it. Where did they go to search? How did they decide which studies would be included, which studies would be excluded? Were there certain types of research designs that they were focusing on? Were they only looking for studies done in certain populations, certain kinds of interventions, what types of outcomes they were measuring? Is there data provided on those outcomes, and even potentially data provided on outcomes by certain types of populations? So the methods generally might be 3-4 paragraphs long. That might tell us about inclusion, exclusion, search, quality appraisal of those studies, how they synthesized the evidence, and that's where you can really answer almost all of your critical appraisal questions. And so if that's your task first, to find out is this good enough to invest any more time, you're jumping right to that method section. And then, of course, our results are going to give us in both text and table format a summary of the findings of those individual studies. It will usually start off with telling us how many studies were found from their search, how many ended up being deemed relevant, and if any other were excluded for various reasons why that happened. We also usually then end up with a paragraph that tells us about the quality of the evidence base. So across those studies, were there things that generally were done well in the literature and the evidence base? Are there some commonalities of limitations to the studies? So a good description, which is very important for us to understand what the quality of the evidence is. They usually want to then tell us a bit more about those studies. So of course, one of the things that we lose as we go from single studies to systematic reviews is we do lose a more in-depth description of what the context and setting for the individual studies. However, it's still important for the researchers to give the reader enough detail that you can make a decision as to whether or not the population is similar enough to yours, or the context, or the interventions. And so we see that in both text form and in table forms. Demographics of study participants, the intensity and frequency of the intervention, when the outcomes were measured, things like that. And then as well also what the specific findings were, whether those are relative risks, odds ratios, 95% confidence intervals, all of that type of data provided in our results. And here's one example of what you might see or what you would see if what you had in front of you was a meta-analysis. And so a meta-analysis really is just a systematic review that goes one step further in terms of statistically aggregating the results of multiple studies to come up with one overall effect size. And a meta-analysis will produce the type of, we call this a forest plot or a blobogram that you're seeing right now in front of you. And so we can see here in this review by Cleland, which is on the effectiveness of interventions to promote physical activity among socioeconomically disadvantaged women, we can see here from this forest plot how many studies contributed data, and we see the authors' names and the year those studies were published down the left-hand column. We see what the overall, the standardized mean difference for each of those studies. So we see the specific result from each of those studies, as well as moving into the middle, we have the weight that each of those studies then ends up contributing to the overall answer, which is that diamond we see over to the right. And then just the column that's right before our plot gives us the overall effect from each study and its 95% confidence interval. So we know that it's very important that we see both of these types of statistics in terms of the actual result of each study and its 95% confidence interval, because it's all of this data together that tells us whether or not, it tells us the real story of what would happen if we applied these results to the larger population. And so just very, very briefly here, we have a vertical line that for this particular meta-analysis is labeled with a 0. That's really known as the line of no difference or the line of no effect, which if our 95% confidence interval touches that line, tells us that there was not a statistically significant difference between those who received the intervention and those who did not. In other words, those who were in the control group. So we can see in this particular meta-analysis that we have a number of studies, approximately half of them touch that line of no effect, which generally then illustrate that the intervention was not effective in comparison to the control group. It was not effective in promoting physical activity among socioeconomically disadvantaged women. And then we do see here any confidence intervals that lie to the right of the line of no effect show a positive increase in physical activity for women in the intervention group. And if we had any where the confidence interval was to the left of the line of no effect, then the result there would be indicating that those not exposed to the intervention actually did better than those who received the intervention. So in other words, that appears that the intervention may in fact have harmed those exposed to the intervention. So just quickly here, our overall finding here tells us that we have a statistically significant effect when we add up all of these studies, that those who received interventions to promote physical activity were more physically active following the intervention than those who didn't receive it. And we know that the answer is statistically significant because no part of the diamond touches that line of no effect. So, I briefly went through that because in our travels across Canada interacting with public health decision makers, often looking at these types of forest plots can be intimidating. We've heard that these are intimidating, but in fact, if you know what you're looking for and have the basics for understanding this type of a forest plot, you can tell within seconds what the overall result of this review is, which will significantly save you time in terms of taking that first type of a look at this type of evidence. Of course, if you were going to choose to use this evidence to consider as part of your program planning, then of course you would spend much more time reading through the text and really getting fully ingrained in what the studies were saying. We move on then to our next parts of a systematic review, the discussion and conclusions. Of course, in the discussion now we're trying to make sense of the findings of the review. We want to compare those findings to what others have found previously. So what do if there's other similar systematic reviews, what did they find? If there's a newly emerging study, how does it compare and contrast to the body of literature, and also an opportunity to think about what limitations there might be in the review, and more importantly, what impact those limitations might have on the results that were obtained through the review. And then generally, the discussion will also address then what implications for policy and practice might be gleaned from looking at these results, and then finishing off with a conclusion that's usually quite short, that really gives those high level, what do we make of these findings. With respect to critical appraisal, so hopefully we're at a point now where the majority of the time you will not need to do a critical appraisal of a systematic review if your question is about the effectiveness of a public health intervention, because we have a variety of sites, a number of which are developed right here in Canada, that have compiled all of this evidence in one place. And so, of course, healthevidence.org is a repository of systematic reviews that evaluate any intervention relevant for public health. They've all been assembled freely accessible online at healthevidence.org, and that critical appraisal has been done for you, and you can access those appraisals and take a look at them and then use them accordingly. However, it could be that you may have found one that's hot off the press. It was published yesterday, and that hasn't been added to health evidence yet. Or it could be that you found one that's in the unpublished literature, because that health evidence does not include unpublished systematic reviews. And so it could be that you've come across a review that does require critical appraisal, and you want to be able to do that as quickly as possible so you can decide whether or not you want to invest any more time. So there's a couple of resources that you do have available to you. So also through the NCCMT, we've created a compendium of critical appraisal tools. So there are many groups around the world that are in the business of developing tools and making those available. It can be a bit confusing which one to use. And so we've created a compendium here that would outline the various tools and which instances you would use them. They would also be available on NCCMT's registry of methods and tools, with links embedded within those to take you right to the online site where that tool would exist. And there are some great examples of these tools that can be completed online. You can create a profile and store your completed reviews so that you could access them as well at a later time. So one example that we will use for today as well is the tool that Health Evidence uses, which is a little bit different from the AmStar tool that exists, which many may be familiar with. And the Health Evidence tool really asks 10 questions, and those questions range from, is there a clearly focused question? Have they clearly and explicitly identified the inclusion and exclusion criteria? Have they identified and described their search, and is that search comprehensive? How many years back did their search cover? Did they critically appraise the primary studies? Did multiple people contribute to all of those components of the review in terms of determining which studies would be included, what the quality of those primary studies were, and what data would be extracted? Ultimately, you want independent raters to be doing all of that information and then coming together to discuss any discrepancies. And then you also want to know, how did they aggregate all of that data? So how did they make sense of it? If it's more of a narrative review where they're not statistically combining all of that evidence. And so one of the first things that we can do, and here this is the review that we're using today for the rest of this workshop. So the effect of intervention programs in schools to reduce screen time, and it tells us that it is a meta-analysis. And so if this was the review that you were looking at for your program planning, we'll walk through now how the anatomy of a systematic review fact sheet can be helpful. So first here, we just want to know, before we even look at this review further, what your thoughts are about whether or not intervention programs reduce screen time in school children. So just wondering what your thoughts are, your knowledge is about this generally. Again, here the options that we're giving you range from you strongly agree that they do reduce screen time, through to agree, you're neutral, you disagree, or strongly disagree with that. And we're going to come back and we're going to walk through the review in a moment, look at what the results are. So of those of you that are answering the question, about a third so far have indicated that they do agree that they do reduce screen time. We have a few that are neutral and just a few that are saying they disagree with that. So thank you for providing that with us. So one of the things that we can do here is there a clearly defined question? Where can you go to answer this question most quickly? So there's a few places you could look at, and the first would be looking at the title. So can we get this from the title? If you can't get it from the title, can you find it under the purpose? Which we can't tell from this one because this review isn't, this screenshot isn't in English, but what we can see here is generally the last sentence of the introduction section, and usually the sentence that's right above the methods, tells us what the study question is or what the purpose of the review is. And we can see here this says, this study presents the main results of a meta-analysis aimed to evaluate the effects of interventions conducted in the school environment on the time dedicated to activities such as watching television, playing video games, and using a computer. So, if you can't address your population, your intervention, what it's compared to, and what your outcomes are by reading the title, the next fastest place to go is to this sentence right at the end of the introduction. The next thing we want to look at then is our inclusion and exclusion criteria. So do we know very explicitly how the researchers made decisions about which studies would be included? And we can see here in now our third paragraph of the methods section of this review, they say the following inclusion criteria were used. So they've told us they're looking for randomized controlled trials. We know that they have to have been published since 1998, including that year. But the studies had to include school children aged 4 to 19 years old. That pre and post measurement of time spent either watching television, playing video games, or using the computer is included in that study, and that the interventions or programs focused on changes in sedentary behavior aiming to reduce screen time, and that the interventions also had to be a minimum duration of 3 months, and they had to be conducted in the school. And so this is a really nice example of a very clearly, explicitly stated inclusion and exclusion criteria. And you can see this nicely right from this paragraph in the methods section. Then, and actually I'm just going to back this up here for a second. Let me just bear with me. What we see in the very first paragraph then of the methods section is how they searched. So the next thing we want to know is that how we want to feel confident that the researchers haven't missed anything in their search for the single studies that make up this review. So they have to convince us that they've done a very good job of searching for all of the studies that answer their question, whether it's published, not published, in English or other languages, that they've used multiple databases, they've gone back an adequate number of years. Those are all of the things that we're looking for to assess that. And we can see here in just these first few paragraphs, which are really very short, what their search strategy was. So we can tell here they've gone to multiple databases, Lilacs, PubMed, Web of Science, Scopus, Embase, the Cochrane Library. They've told us the years, and then they've also, in this paper, have told us what keywords they've used. Sometimes they might provide an appendix, the exact search strategy, which is also good to see. And then they've told us exactly what types of research designs they're looking for as well. They've also told us then that in addition to looking for the published literature, which is what that first paragraph is going to get for us, they've also told us that they've looked at the references of relevant studies and systematic reviews as well. And so an additional strategy that might pick up studies that were missed in the databases or potentially might pick up unpublished research. The next thing that we then want to look, and this is on page 235 of the review. This gives us, and this is kind of jumping into a little bit of our results, but we really want to know what the quality of those included studies are. So we not only want to know were those studies of good quality, or in other words, low risk of bias, we want to know what exactly they assessed in each of those primary studies. So there's really two things we can look at here. In our methods section, there should be a nice detailed description following our search strategy usually and our inclusion criteria. There should be a paragraph that tells us what types of characteristics they assessed around quality of those primary studies. So how did they assemble their sample? How did they allocate participants to the intervention or control? How many people participated in the study? How many people were finished the study? Or in other words, what was their dropout rate? You know, are their data collection measures reliable and valid? All of those types of things we want to know. So they should, and the researcher should be telling you very clearly what they used to assess it, who did those assessments, and ultimately we would like to see at a minimum two people, two of the researchers on the review, independently looking at each of those studies, assessing quality, noting those, and then coming together to discuss their findings and coming up with a process for resolving any disagreements they had on those assessments. And then the next thing that we also want to look for is that this has all been nicely laid out for us so that we can very quickly look at each of those studies and assess, look for ourselves how each of those studies did. And this example here on page 235 is a really nice example of how to do that. So we have all of our studies that were included. We know when they were, what year they were published, what country they were published. We know how many participants were in them, how old they were, gender. So this table also builds into it a little bit of the demographic information as well as that quality appraisal. Sometimes we would have a table that is just giving us those quality indicators, each one individually, and then an overall assessment or of that quality. and then you might have, as a completely separate table, some of the other demographic kinds of information. So 2 places you would look here. Again, in the methods, a short paragraph about how quality was assessed, and then jumping usually to an appendix. Sometimes it might be in the results section as a table like this that you can take a look at. So now on page 234, we also want to know then about the transparency for the methods of data extraction. So again here, we want to know one of the key factors that sets a systematic review apart from other types of literature reviews is that you have more than one person making these decisions about which studies make it in, assessing them for quality, as well as extracting the data from each of those studies. So again, here we have a nice paragraph, which is still part of methods, that the information was independently extracted by 2 reviewers to collect data from those selected studies. The results were cross-checked to verify concordance, and discordant results were resolved by consensus. And then the assessment by the reviewers was not masked regarding the authors. So this is just telling us here that those who were doing the assessments also knew who the authors of those single studies were, but they did their assessments independently and then came together to discuss any differences and come to an overall consensus for each and every study. Sometimes what we might see in addition to this is a third reviewer might come in if there was a tie and they couldn't resolve their consensus. A third person might come in to help in gaining that consensus. So again, this is all just within a few short paragraphs of the methods that we can determine how well the reviewers did their job in that part of the review. So here we're now some other questions that we want to look at around the quality of the systematic review process is how did the reviewers assess whether or not the results of those studies were similar enough that it makes sense to create a diamond like we see here on this forest plot. How did they go about determining what weight each study should be given in the overall results, and whether or not the overall interpretations that the authors come up with of the data actually coincide with the actual data that we see on each study. So again here, this is the result of our review on school-based interventions to reduce screen time in children. And a few things that are identified here for us. We see that we have, I don't know, it looks like about 12 or 13 studies that were included in this review, and we see they range in publication date from 1999 to 2012. The weight column, which is the third column, tells us here how much weight each individual study contributed to the placement of that diamond. And we can see here that they're relatively similar weights assigned to these studies, with the exception of Weintraub, which has only a weight of 1.6%. So in other words, that study really contributed very little influence on where this diamond ended up being allocated. And what you would also note, if you spent a bit more time looking at this forest plot, is that the studies with the largest or widest confidence intervals, so those horizontal lines, those represent the 95% confidence intervals for each of those studies. When those are really wide, they generally represent small studies that had few participants, end up generally being given the least amount of weight in the overall effect size, so in other words, the diamond. And we would then also see that the most narrow confidence intervals end up having the greatest weight. And so Gortmaker, I believe, is one of the highest ones. We can see that is a very narrow confidence interval, and it in fact is 8.1% exerted 8.1% of the influence on that diamond. And there's one more in there that's also at 8.2 by Gentle in 2009. So just very briefly in terms of what we see here, in this particular instance, we want to see children engaging in less time in front of TVs, playing videos, so less screen time. So results that occur to the left of that vertical line, which is, again, the line of no difference or no effect, results that occur to the left of that line mean that the intervention resulted or led to a reduction in that screen time. In other words, may be indicative of a positive effect of that intervention. So our confidence interval cannot touch the line of no effect in order for us to be able to say there was a statistically significant effect of the intervention on reducing screen time. Any confidence intervals for those individual studies that touch the line of no effect tells us that that particular study did not have a statistically significant effect. So in other words, those being exposed to the intervention had no less screen time than those who didn't get the intervention. And if we had had a study whose confidence interval was completely to the right of the line of no effect and did not touch it, we would say there that those who were in the control group were better off, had less screen time than those in the intervention. So something happened there. In this particular instance, we can see here that we do have a statistically significant effect, positive effect, in that those exposed to the intervention had less screen time than those in the control group. We know our finding is statistically significant because no part of our diamond touches the line of no effect. And we can see here that we're using here a standardized mean difference, ranges from a minus 0.37, which is on the left-hand side of that diamond, to, so that's like, in our best case scenario, our best outcome could be minus 0.37 to minus 0.13. For those of you who may not be overly familiar with standardized mean differences, I'm actually not going to get into that today. That's a whole separate conversation. But be on the lookout for a new Understanding Research Evidence video coming out by the NCCMT, likely in the next 4 to 6 weeks, with the topic of understanding standardized mean differences. But in this case, what we do know is our rule of thumb is that because standardized mean differences really is unitless, it's not tied. This isn't minutes or hours or seconds or days. It really is just a number. And in this case, we use a different type of metric to assess how big this effect is. A general rule of thumb is that standardized mean differences that are 0.2 and less are considered small effects. Between 0.2, above 0.2 to just below 0.8, we would say is a moderate effect, and anything above 0.8 is a very large effect. And so what we have here is a small to moderate effect in terms of the decrease in screen time. The last thing that I'll just show you here is around heterogeneity, and that's our circle, our red circle on the left-hand side here below the forest plot where it says heterogeneity, and we have a CH to the power of 2 equals 101.45, so some of those numbers there. What's really important here, a couple of things, the researchers need to tell us in their methods section again how they assessed whether or not the results of each study were similar enough that it makes sense to do this diamond. You have to keep in mind that the stats package, as long as you input the data correctly and in the right format, when you hit enter, it's going to calculate the diamond for you. It's not going to tell you whether or not you should or shouldn't be doing it. It leaves that up to you to make those decisions. So we have to determine whether or not it's appropriate to create this diamond by assessing whether or not these results from each study are similar enough to each other that it still makes sense to aggregate them. We do see here that we have some issues. We have at the end of the data that's in that red circle under heterogeneity, an I-square equals 85%. And that essentially tells us the closer we get to 100%, the greater there's more and more differences between these results. So this is indicating that these results really are fairly different from each other, so there's likely a bit of caution there that could be indicating maybe the results are quite different, or maybe we need to think about why these results are different. Maybe the populations were quite variable, or the intervention was quite different that may be explaining some of these differences. The tools that were used to measure screen time maybe led to some of these differences. But it is very important to, one, know and identify what the authors did to assess heterogeneity, and then if they did see a lot of heterogeneity like they do here, then they need to use a certain type of formula, which we call a random effects model, to aggregate all of these results if they determine it's still reasonable to create the diamond in the first place. So just as a bit of a recap here, we want to make sure you need to be assessing that the researchers have assessed heterogeneity, and also that if there is a lot of difference, then they've adequately and appropriately aggregated the data using appropriate formats or appropriate models based on their assessment of heterogeneity. So now that we've looked at, I'm actually just going to ask you now that we've actually looked at the results of these school-based programs to reduce screen time, I'm just going to ask you again what you think now as to whether or not intervention programs reduce screen time in children, and ask you to rate that again from strongly agree to strongly disagree. I'm going to just back us up here and let you look at that slide one more time as you're answering that question. And as we see some of the data starting to come in now, you might have moved one person from agree to strongly agree, but look, seeing some fairly similar results from before in terms of a majority of people kind of falling into that agree, you agree with that statement. And we still have a few, don't know if they're the same folks, that have stayed with the disagree. So thank you for providing your responses to that for today. For additional information, the review we're using today is an open access review, and the link is provided here. And of course, we found this review in healthevidence.org. And it's one of approximately 4,200 systematic reviews that are available that evaluate public health interventions. And this review was rated as a very methodologically strong review and received a rating of 9 out of 10. And you'd be able to see how we rated that if you went to Health Evidence and specifically clicked on the link to look at that, our assessment of it. This is also a review for which a short summary has been written. So for some priority topics in Health Evidence, we write short summaries that pull out the key findings of the review, implications for public health policy and practice, as well as a short paragraph on the scope of this problem supported by Canadian statistics, also provided in that review. If you want additional practice in critically appraising systematic reviews and learning more about systematic reviews, we do, as I indicated before, have a suite of videos called our Understanding Research Evidence series. We have one on the types of reviews, where we look at the different kinds of reviews that exist that you'll come across in the literature, what their differences are, and what strengths and limitations different types of reviews have. And we also have another video on forest plots, so understanding a meta-analysis or 5 minutes or less. And we also have one on 95% confidence intervals and understanding those. For those of you that aren't familiar with these videos, they are short, anywhere from 5 to 8 minutes in length. You can access them either through NCCMT.ca website or on YouTube. They are a combination of presentation style as well as cartooning. We've used very layman's terms to explore these concepts, and they all revolve around very relevant and practical public health issues that you would deal with on a day-to-day basis in practice. We also have our suite of online learning modules where you can spend additional time developing your own skills. And we currently have 3 modules that look at systematic reviews, critical appraisal of intervention studies, as well as critical appraisal of qualitative study. And then we have one that will be released very shortly, which is on the critical appraisal of practice guidelines.
Great, so thank you so much, Dr. Dobbins. And we have one of our last poll questions here, which is asking you, what are your next steps? So after today's webinar, would you access the Anatomy of Systematic Review fact sheet? Would you read the NCCMT summary of the fact sheet? Would you consider using the fact sheet? And would you tell a colleague about the fact sheet? So as the numbers are sort of coming in your responses, and we thank you for those, it seems that actually everyone's it's pretty well distributed amongst all of the answers, so it seems that makes us very excited that it sounds like this webinar is hopefully quite useful, and you'll be able to actually have some next steps after this. So what we're going to do now is we're going to actually open the forum up for questions. So thank you to those who've been posting some questions in the Q&A as we have gone along, and I'm going to ask those of Dr. Dobbins now. So if you do have any more questions that you can think of as we go along, please post them in the Q&A, and I will have Dr. Dobbins address those. So if we actually go back to slide number, there's 2 questions actually that refer to the meta-analysis on slide number 31. And Nicole and Anjeet have asked a bit about the weighting of individual studies. And so Nicole asked, when assessing the weight of individual studies, what would be cutoffs of concern? For example, what's the maximum and minimum to look for? I assume as well higher weighted studies with a smaller confidence interval would be something to look for.
Right, so really, really good question, series of questions there. And so one of the reasons that we do a meta-analysis is that it actually gives us more power, because we are increasing the overall sample size when we add the sample, the number of participants from each individual study all together to now make this much bigger study. So the whole purpose behind doing a meta-analysis is that it should in fact be helping to create a more precise estimate, so that 95% confidence interval should be much more narrow than any of the individual studies that would be comprised here in this forest plot. So keeping in mind, what we're trying to do in a meta-analysis is to be as precise as possible as to what the real effect may be if we used or played this intervention out in the real world with the real population, what is the best and worst case scenario of what we might see as a possible effect of this intervention? So there wouldn't necessarily be any cutoff of what we would be extremely worried about as it relates to it being in this, what we see here in this forest plot. However, what I would draw your attention to, right in the middle here of this forest plot with Weintraub 2008, which only ended up having 1.6% of the overall weight. And if you follow that line across to its corresponding 95% confidence interval, we can see that this is a very, very, very wide confidence interval. This is one of the reasons why it's important to do systematic review and meta-analyses, because if you only have this one study and you came across this study and you took a look at it, well, this study tells us that there was no statistically significant difference between those who received the intervention and those who didn't on screen time in children. It's also an extremely wide confidence interval that leaves us really quite unsure of what's really going on here, because we go from it being could be highly effective to being actually harmful. What we know from statistics is that when we have very, very small studies, we really don't have the strength or the power to see relationships that might really be there. So in fact, a small study there could be an effect on that intervention group, but we don't have enough strength in that study to see that relationship emerging in the data. That could be an answer. So in other words, if we were reading this study, the publication of this study by Weintraub, you know, they could say in their conclusions or their discussion that either the intervention just didn't work in this case, or we ended up being underpowered to see a difference that really is there. And you wouldn't necessarily know that if you have a very small study. And so what we want to do is to have bigger numbers, which adding up all of the participants from all of these studies allows us to do. So we don't need to be concerned here that the Weintraub study only had 1.6% of the influence on that diamond, because in the end it's actually exerted a very small influence on them. Sometimes where we might get concerned is if we had, let's say, only 5 studies, and one of those studies was a giant in comparison to all the others. So let's say all the others had, you know, under 100 participants, and one study had 5,000 participants. Well, that study now is going to really dwarf the results of all of the other studies. Because it is such a large study, it will have a it would likely have a fairly narrow confidence interval, and it will comprise a large percentage of the overall weight of that diamond. It doesn't mean we don't do it. We don't do the meta-analysis, but you know, that diamond will end up looking an awful lot like the result of that individual study. And so then in those instances, you'd really want to be then taking a closer look at those individual studies as well, and who those participants are. So I'm just quickly looking to see if I've adequately addressed that question. And certainly if you were looking at the individual studies, I mean, certainly the more narrow the confidence interval is, really the more confidence we have in understanding in the worst or best case scenario what that plausible result would be at the population level. You know, we intuitively will feel more confident in that type of a result than we would in a result that has a much broader confidence interval.
Great, thank you. And Nicole has said, yes, thank you. You have addressed her question.
Great.
So in keeping with the meta-analysis here on slide number 30 or page 239 in the actual review if you're following along, and Jeet had a question about, do we always have 100% total for the weighting? Does it always seem to, is that always the case?
Right. So for a meta-analysis like this, yes. So in this case, again, of these 12 or so studies that are included in this review, they all are contributing to that diamond, and therefore that must add up to 100% in the meta-analysis. So, you know, you're inputting data into a software program for each and every study, and then it will weight all of those accordingly to various factors to come up with a weight for each of those studies that will add up to 100% at the end of it. The only time where it might look confusing, and I was just doing a workshop last week where we had these types of results, sometimes you will see a meta-analysis that kind of chunks the studies into or categorizes them. So this could have been a meta-analysis of 3 types of studies where they then add those all up in the end, but they could have looked at this as data just for watching TV and created a diamond, playing video games and created a diamond, and in front of a computer and created a diamond, and then added all of those diamonds up to come up with one overall diamond for screen time at the bottom. So sometimes they break that outcome into sub-outcomes, but then add it all up into one at the bottom. In those instances, the weighting may be confusing because the weighting is then, again, goes back to the overall diamond that would be at the very bottom and not tied specifically to the weighting of each of those sub-diamonds. What we could do following today is, along with the webinar, Jenny, we could put the results of this particular review that I'm talking about. We could provide a link to that review, and you could take a look at this example that I'm talking about right now.
That's really great. And just to follow up, and Jeet had just a question about, you know, because sometimes you don't find much literature. So in terms of what does the 100% make up? So if you don't find enough literature that adds up to 100%, what do you do in that case?
Right, but that won't happen when you're doing this systematic review. I think you're mixing a few things together there. If, for example, if there were only 4 studies, if they had only found 4 studies that met all of their relevance criteria with the correct kind of data that they needed to be inputted here, then those 4 studies would be the only ones included on this forest plot, and they would all be assigned their relative weights that would in the end add up to 100%. So the weighting will just change there to coincide with the amount of evidence. It's up to you to decide whether or not what your comfort level is in making a decision if all there was 4 studies, which is a different question, right? What is enough evidence to base my decision on? Many times we'll see Cochrane reviews that end up with only 1 or 2 studies, and they might say at the end, we feel there's insufficient evidence at this time to really make a definitive recommendation of what's going on here. We see that sometimes. You know, and those of you on the phone may have different opinions. Maybe 4 studies is adequate for some of you. For others, 4 studies might not be enough. Or you might say, well, it depends how many people were in all of those studies. So it really will be a bit of a personal decision there, your threshold of what constitutes enough evidence.
Great, thank you. And sticking with this forest plot here, Shannon had a not silly question, but she was wondering what the correct question or response was to the last polling question. Are interventions to reduce screen time effective or not?
Right. So great, yeah, that's not a great question. I mean, it's not a silly question. And so if we go by just what we see here on this forest plot, we do see that these interventions, we haven't really talked much about what the interventions are, except that they happened in the school and they were focused on reducing screen time in children. The results of these studies illustrate a statistically significant reduction in screen time among those children exposed to the intervention compared to those who aren't. And so, yes, these results say the intervention is effective. Yes, it works. Our second question is it a big enough impact that that it's reasonable to use the kinds of resources that would be required to implement this kind of intervention? That's a separate question. And that question is answered by looking at how far away our left and right-hand points of the diamond are from the line of no effect. So the farther away from the line of no effect our diamond is, the bigger the effect that we've had. What I started to get into there, it's a bit tricky in terms of interpreting standardized mean differences. In this instance, a standardized mean difference has been used to aggregate all these findings because it's likely that these studies use different ways of measuring screen time. So in a way, it's like adding up apples, but they're all different kinds of apples. So it's still screen time, but it could be Red Apple, Red Delicious, Granny Smith, Royal Gala, right? And it really not optimal to add them up when they're kind of different. And so we just want to get rid of the individual units that each study used and kind of standardize, come up with a standardized measurement, and they're all converted into that and then aggregated. And so our rule of thumb being that an SMD, a standardized mean difference of 2 or less, is really a small effect. And we can see here when we read across that total row, our overall effect when we add all these studies up is minus 0.25, and then it ranges from, so 95 times out of 100, the real true effect, if we were to implement this intervention, so our true effect for the whole population ranges from minus 0.37 to minus 0.13. So we know that we're going from anything 0.2 and less is small. So in the worst case scenario, we have a small effect, and anything between above 0.2 to below 0.8 is a medium-sized effect, and anything above 0.8 would be a very large effect. So in this instance, worst case scenario, we have actually a relatively small reduction in screen time to a modest reduction in screen time. So it's two different answers, two different questions going on here. Yes, do we have a statistically significant positive effect, meaning a reduction in screen time? Yes. Next question, is this a big enough effect to warrant all of the resources that would be required to implement that into practice? And again, some of you may say yes to this question right now with this data. Some of you may say no. And you would use other kinds of information about, well, how much would it cost to implement that? What type of staff training do we, what types of costs would be involved in training the staff, and do we have a lot of staff turnover? Many things would get factored into then your decision around, is this a big enough impact to warrant the resources? So I hope that helps a little bit.
Great, thank you. And I think it briefly got mentioned in addressing this last question, but Patty Leek had asked, from a meta-analysis, how do we know which elements of the intervention lead to the highest effect? Do we then go to the individual papers to see how they perform the intervention?
Right, so again, really, really good question. And, you know, if I just walk through that process, you know, you've come up with an issue, you have an issue, you clearly define that, you then find the evidence, you use our anatomy of a systematic review fact sheet to very, very quickly identify if the review has been done well enough that you feel confident in using its results, or even better, you found it on health evidence and it's already been appraised for you. Now you look very quickly at this overall result and go, oh, okay, something's going on here. Something's going on here and it looks like there is a positive result. Now you're going to get much more into, well, what specifically was going on? And so it may be that you do end up needing to go look very specifically at individual studies. For example, you might want to know a lot more about the participants and the settings and the interventions that were implemented. And that, to get that level of detail will require you to go and look at the individual studies. If a reviewer has done his or her job well, or the review team, they're going to try to write a synopsis to the best of their ability that kind of gives you a sense of what the best mix of interventions or activities were that they think result in this positive effect. However, when there's lots of different interventions that are happening within one program, you know, your question is very good in that we can't pull out which individual item may be that most important ingredient that's leading to that change. We really kind of lose a little bit of that detail when we mix many interventions together within one study. But really that would be your next step, to look a little bit more closely at those populations and to really understand that if you are now going to implement something, you're going to go to those individual studies to look more specifically at what those interventions were.
Great, thank you. And Irene Bueno asked, how would you present just qualitative results? So we have the meta-analysis here for quantitative results, but how would we just present qualitative results?
Right, so again, fantastic questions that everyone's asking today. So we do have syntheses of qualitative studies. So sometimes they might be referred to as meta-syntheses, but it would not be unusual to see a synthesis of qualitative studies. And the first thing to remember is it's still a review. And if it is a review, then it should use the kinds of processes and criteria that we've discussed today in its process of compiling these qualitative studies. So is there a focused question? Have they clearly articulated which qualitative studies will be included and why, and which ones would be excluded? Have they done a comprehensive search to find all the qualitative studies, published and not, in any language that address the question being asked? And then how did they assess the methodological quality of all of those qualitative studies, the individual qualitative studies? And then you would also want the reviewers to be telling you then how they synthesized the results of all of those qualitative studies. And so first off, you would be looking for a good quality review that has explicitly told you all those things and that they've done a very good job of doing all of those things. We would apply the same types of criteria as we would to a synthesis of quantitative studies. Then once you've assured yourself that it's a good quality review of qualitative studies, then thinking about how they might present those results, you know, we would anticipate that it should look very different from what we might see in terms of quantitative. We're definitely not going to see anything like what we have here in front of us of a forest plot. I guess what you might see is they might present results by themes that have emerged from the qualitative analysis and then looked for similarities in the themes across those qualitative studies. I would hope that they would use a qualitative approach to synthesis that would guide how they might go about doing that. Another way that they might do it, and we see this as well with quantitative, they might present the results by population or by the interventions or by the outcomes, and then again specific themes that they may have seen across those studies. So there's likely multiple ways in which they may do it. Some of the important things to think about is it should be very clear in your mind from what they've told you how they did it. So you should, in essence, what we're trying to achieve in explaining our methodology of a review is that if someone else wanted to replicate what we did, they should know enough about what we did from our methods section that someone else could in fact replicate it. So that's what you would be looking for there as well.
Thank you. So another question is, are there any examples of systematic reviews presented as PowerPoint, for example, for a conference?
Well, certainly. I think what you're getting at there is, so if someone conducted a systematic review, how do you go about presenting the results of that review, I guess that review and its results at a conference? And certainly many conferences, including the Cochrane Colloquium that's held every year, but many other conferences I've seen systematic reviews being presented. And again, there, you know, depending on how long you have for a presentation, you might see traditionally what was the purpose. Very similar to, I'm just going to change our slide here, take us back up to the top, and we might see a slide deck that looks a little bit like our, you know, what's the purpose or our introduction, a couple of slides on our methods, a couple of slides or more on our results, and our overall discussion in terms of interpretation and conclusion. Depending on what you were focusing on, if it really was about the results of the review, you may want to have fewer slides, and if you only had, for example, 15 minutes, you might want more of your slides that are really looking at your methodology, your results, and you may include forest plot tables or other kinds of tables, as well as some slides around the interpretation of those results. But certainly there would be many examples of PowerPoint presentations of systematic reviews. One place perhaps to look would be whether or not the Cochrane Colloquium posts any of its PowerPoint presentations online from previous colloquiums, and you may be able to access some there. If you really can't find any, you should contact us directly at Health Evidence, and we could certainly help you in that regard of finding some.
Great, thank you. And it seems that if we have one last question, unless anyone else has any others, please go ahead and post those into the Q&A. But another question about systematic review. Would the bias assessment be presented as its own section in the paper? And also, would it go before and or after data extraction?
It depends. I suppose some folks might do it slightly differently. Myself personally would likely put it ahead of data extraction and then move on to data extraction. Some folks combine, and I think not quite, for myself, accurately, they lump data extraction, so pulling out information on demographics of the participants, for example, and the size of the sample. They lump that together with risk of bias factors and then do it all at once. I mean, when you do it isn't necessarily, a really big issue, but I would tend to write about them separately and write about the risk of bias, which is another way of saying critical appraisal, before I talked about data extraction. However, I think the point to really mention here is the most important thing is that they actually talk about how they do both of those, as opposed to what order they occur in the method section. So not every review is going to have everything in the exact order that we've talked about today, and you may need to look a little bit more through that, and sometimes they don't label things quite as clearly as maybe they could be. And then in terms of the results, generally what we tend to see is, your first paragraph of the results or first sentences are going to be about how much literature was found and which studies, how many and which studies end up being included in the review in the end. And that is usually followed by a description of the actual quality of the evidence that's been included in the review, and giving an overall summary of what tended to be overall strengths of the literature and if there were some commonalities in the limitations or biases, then those are also highlighted. And the last point that I would probably just raise there is it's also really important then that quality is also used to help put context around the findings. A lot of times what we see in reviews is this kind of standalone description of the quality of the individual studies, from very poor quality to good quality, and then that's kind of put aside as they spend the rest of the results and discussion just really highlighting what the results were, and never really kind of bring back in kind of like a tapering of our assessment of the results by taking into account the quality or biases that were identified in that evidence base. So it's really important that all be weaved together by the researchers in coming up with their overall interpretation.
Great, thank you so much. So seeing as we have no more questions, but they've been some really great questions, we thank you for your time and joining us today. And I'll just, as we pull up the last slide about how to contact us here at Health Evidence, should you have any further questions, I would just ask Dr. Dobbins if she has any final thoughts to leave with us today. And while she's pondering that, I'll just let all of you know that following today's webinar, we will be posting a webinar companion on the National Collaborating Center for Methods and Tools website, and that will just sort of provide a summary along with some screenshots of today's webinar. So we thank you all for participating. You'll see a link pop up to a follow-up survey, and you'll get an email to that as well. And I'll just leave the final thoughts to Dr. Dobbins.
Really not much, but it was really my pleasure to have this opportunity to talk about the anatomy of a systematic review fact sheet with you today. We will be hosting many more webinars in this fiscal year, and so please join us again starting in September, and we'll be running monthly webinars focusing on methods and tools. If you have a particular method or tool or a resource that you'd like to see highlighted, we're definitely interested in receiving your suggestions. So you can either contact us directly. You have the contact email is up on the slide right now, or send them specifically to Jenny or I or any member of the National Collaborating Center for Methods and Tools. We'll do our best to include that in our series as we move throughout the year, September through to March. So we hope you'll join us again, and in the meantime, wonderful and safe summer for everyone, and if there are any comments or questions you have for us, we're always here for you to contact us. So thanks for joining us today. Goodbye.